So have you been feeling off lately, not like yourself, and you've been to your doctor and they can't really explain why all your labs are normal, so this must all be in your head, right? You're feeling more tired, gaining weight, maybe a little depressed and not sleeping, and just not feeling like yourself, and you know something's wrong, but nobody's finding out what's wrong. You're gonna wanna listen to this. I'm Joy Evanderline. I'm a functional medicine nurse practitioner here in Illinois, licensed in many other states. What I do is I like to get to the root cause of problems and solve those so you have no problems. We're not masking problems. Hormone imbalance is what I want to talk to you about today. Hormone imbalance can be a major root cause of all these kind of odd, otherwise unexplainable symptoms. So listen up. You are going to learn some cool things today. So different hormones control many, if not maybe almost, functions that happen in our body, from our mood to energy to sleep to muscle mass to even risk of Alzheimer's, cardiovascular disease, and osteoporosis, let alone things like libido and vaginal dryness and erectile function. Hormones are such important pieces of our sort of physiologic symphony that when they're imbalanced, any number of symptoms can occur. And because there are so many symptoms, sometimes that constellation of symptoms is hard for somebody, a provider, to identify unless they know to look for it. Fatigue and sleeping problems, insomnia, either falling asleep or staying asleep, can be a problem when hormones are off, whether that's progesterone or testosterone or cortisol. Cortisone can cause huge problems with sleep and are not always easily tested for in a traditional medical setting. Weight changes are another thing that happen. I hear this all the time. I'm doing the same thing. I'm exercising the same. I'm eating the same, and I'm gaining weight, or I just cannot get these last 10 pounds off. That is so common during perimenopause, menopause, and then also as men start to age. These things happen so commonly. And so we want to look at hormones, look at things like insulin and insulin resistance and glucose levels and inflammation even that affects hormones and hormone signaling. But certainly look at things like testosterone, estrogen, DHEA, progesterone. We want to take a comprehensive look at the hormones and a comprehensive look at the body as a whole to try and help you. Mood changes are something I see all the time. I hear, I just don't feel like myself anymore. I'm yelling at my kids. I'm irritable about things that I shouldn't be irritable about. I'm not used to being irritable about. And suddenly my husband chewing his food from across the table is driving me nuts and I want to, leave him. So that's not you. That is your lack of hormones and you're irritable, and we can fix that. And you don't have to leave your husband, and you don't have to even be annoyed by his chewing anymore. But irritability and even depression, anxiety, racing thoughts can often happen when your hormones are out of balance, and you do not have to live like that, even if your regular labs and your doctors tell you that they are normal. I can help you figure this out and help you fix those symptoms. Hair and skin issues are super common. So all of a sudden somebody's starting to break out, or their hair is thinning, especially here, both men and women, or up here on the crown of the head. So dry skin, acne, especially along the jawline here sometimes, dry, kind of aging, wrinkly skin, these can have to do with hormone imbalances. And so again, we want to test. The way I test is Dutch test for women and blood for men, among the other comprehensive testing that we do to look for and then address those hormone imbalances. Reproductive symptoms can be another thing. Things like low libido or vaginal dryness, erectile dysfunction, even periods that are coming too close together or lasting longer than they used to, heavy periods, clots, heavy clotting when you're having your period, which is not normal for you. So a lot of these can be hormone related and can certainly start to change as we get into, either for females, that perimenopausal or menopausal phase, or for men, just as we age, as you age. One of the ways I like to think about hormones is in a triangle of relationship with adrenals and thyroid and our sex hormones. And so if you affect one, if you change one thing, if one is weak or demanding more resources, the others are affected. And so during a time even of perimenopause or otherwise low hormones, sometimes the thyroid and the adrenals can have to take on extra stress, and then they can become what I like to think about as tired. It doesn't really work that way, but they don't function quite as well, or they're having to take so much of the stress of the functioning because the hormones are low. Thyroid disorders are often missed because in traditional medicine, they're not drawing complete labs. They're drawing a TSH and maybe if you're lucky, a T4 level. But what we really want to look at is those things plus T3, total and free T4, reverse T3, and then the thyroid antibodies as well to determine, is there any autoimmune attack happening on the thyroid, and are your free hormone levels, the ones that are available to attach to receptor sites on the cells to have an activity, are those high enough? Because there are cases, too many cases, it's common, where the TSH, which is that most commonly measured number, is normal, but the hormone levels themselves are not. And we can optimize by adjusting those hormone levels and optimizing for that. I've talked about this before, I've talked about this a lot actually, is menopause and perimenopause are super common phases of a woman's life where these seemingly unexplainable symptoms can be explained by hormone ups and downs or just downs, and can be really easily dealt with by an experienced person, although maybe your gynecologist even or your family doctor even is not truly experienced with managing your hormones. Another situation, diagnosis, condition that can lead to hormone imbalance is PCOS or polycystic ovarian syndrome. This happens more commonly now than it used to, but involves irregular periods and insulin resistance, metabolic syndrome, and infertility. And what we want to do is look a little deeper into what's going on there, both metabolically and hormone-wise, sleep-wise, exercise-wise, nutrition-wise, and really work to create a comprehensive plan with that patient to optimize their hormones naturally. This may go without saying, or this may be news to you, but lifestyle plays a huge role in your hormones. Alcohol, sugar, seed oil, processed foods, your sleep, your stress levels, your exposure to toxins, even perfumes and scented candles affect your hormone levels and can disrupt them. And so a lot of the thing that we do in my practice is talk about all of those things and help you to make good choices when it comes to diet and scented products and what your exposures otherwise, and even vitamins and nutrients that you can and should be taking to help optimize your hormone levels. You're a whole person. We want to treat the whole person. You don't just need hormones. You need help often looking at that whole picture and then setting goals and setting treatment plans for that, for it all, for all of those things. So when should you look for help? Well, if you are running up against a wall and being told that your symptoms are nothing, or they're just expected because you're perimenopausal or expected because you're a certain age, I would encourage you to look for somebody who actually is going to listen to you and care about you and dig with you on the causes and then solutions to those symptoms. Nobody should be getting dismissed when they're talking about symptoms, especially bothersome symptoms that they're having. There should always be kind of a curiosity and a desire to help on the part of the person from whom you're seeking help. And if you're not getting that from your traditional medical providers, oftentimes functional medicine providers who have traditional training but have kind of seen the light and moved forward, are going to be a better option. You can look at our website for an example, nourishhousecalls.com. You can even book a free discovery call with me if you're interested in having a treatment relationship with us. And I can ask you questions about what's going on with you, and you can ask us questions about the practice and what it would take to get seen by us and helped by us. Really, a message that I want to leave you with here, I was going to end the video, but I really want to say this, is you shouldn't settle for subprime care, for suboptimal care. If your symptoms are not getting addressed, if your concerns are not getting addressed, please, please, please find somebody who's willing to care for you and care about you.